Hello, health champions. Today we're doing something a little different. Instead of telling you that some supplement will dissolve your plaque overnight, I want to walk you through what the actual research says about three enzymes you've probably heard about: Nattokinase, Serrapeptase, and Lumbrokinase, and separate the part that's backed by real human studies from the part that's still just theory. Before we get into the enzymes themselves, I want you to really understand what's happening inside your arteries. Because almost every video on this topic skips this part, and it's the part that actually matters most. Plaque is not grease sitting inside a pipe. That's the image most people have in their head, and it's simply wrong. Your arteries have layers, just like the wall of a building has layers. There's an outer muscular layer that lets the vessel contract and relax. There's a middle layer, and there's a thin inner lining called the intima. Plaque doesn't sit inside the open channel where blood is flowing. It builds up inside the wall itself, behind that thin inner lining. That's an important distinction because it explains why you can't just thin your blood and expect plaque to wash away like you'd rinse out a dirty pipe. It's not floating debris. It's compacted material sitting inside living tissue. What's actually inside that plaque is a mixture: oxidized and damaged LDL cholesterol, calcium, debris from immune cells that have rushed in to try to clean things up, and a protein called fibrin that binds everything together. Fibrin is the glue, essentially, in this whole picture. And to understand fibrin, you have to understand what it's supposed to do in a healthy body, because it's not some villain. It's actually essential for your survival. Fibrin is your body's clotting and repair protein. Every time you get a small cut, a bruise, or any kind of internal injury to a blood vessel, your body needs something to seal that injury quickly. That's fibrin's job. It forms a mesh that traps blood cells and platelets and creates a temporary patch. Without it, the smallest injury would bleed indefinitely. So fibrin itself isn't the problem. The problem is what happens when your body produces more fibrin than it needs and more than it can clear away afterward. In a healthy body, there's a constant balance between building up fibrin when it's needed and breaking it back down once the repair job is done. The system responsible for breaking it down is called the fibrinolytic system. The word lytic comes from lysis, which means to break apart or dissolve. The main enzyme your body uses to do this job is called plasmin. Plasmin is essentially your body's natural cleanup crew for fibrin. As long as plasmin keeps up with fibrin production, your blood stays at a healthy thickness, clots get cleared once they've done their job, and plaque formation stays minimal. The trouble starts when that balance shifts, when your body is producing more fibrin than your plasmin system can clear. There are two separate things going on here that push that imbalance in the wrong direction. The first is simply aging. As we get older, plasmin activity in the body naturally tends to decline. That means the cleanup side of the equation slows down, even if nothing else changes. The second factor, and this is the one we actually have more control over, is chronic inflammation. When your body is in a constant low-grade inflammatory state, and for most people today, it is, your liver responds by producing more fibrinogen, which is the precursor protein to fibrin. The word fibrinogen literally means that which gives rise to fibrin. So if your fibrinogen levels are elevated, it's a signal that your body is anticipating tissue damage and is gearing up to produce more fibrin to repair it. This is actually a very useful blood marker, by the way. If you ever get blood work done and your fibrinogen comes back high, it's telling you two things simultaneously: that your clotting risk may be elevated and that there's likely significant inflammation happening somewhere in your body. So where does this chronic inflammation come from? A modern diet high in refined sugar, processed foods, and certain industrial seed oils contributes heavily to insulin resistance and systemic inflammation. Dehydration plays a role too, and not just plain water intake, but having enough electrolytes alongside it, since that affects how efficiently your blood actually flows. Environmental toxin exposure, chronic stress, smoking, and alcohol consumption all add to this inflammatory load as well. And one thing that surprised a lot of researchers in recent years was how significantly certain viral infections, including COVID-19, were associated with abnormal clotting and elevated fibrinogen levels in some patients. That connection between infection, inflammation, and clotting risk has actually become an active area of ongoing research. Now, here's where the conversation usually goes off the rails in most wellness content, and I want to slow down and be careful here. Once people understand that fibrin buildup contributes to plaque, the next logical question is, can we take something that mimics or boosts that natural plasmin cleanup system? And that's exactly where nattokinase, serrapeptase, and lumbrokinase enter the conversation. They're all proteolytic enzymes, meaning enzymes that break down proteins, and each has been studied to different degrees for its ability to support fibrin breakdown in the body. Let's go through each one individually and actually look at what the evidence says, because, and this is important, the quality and quantity of evidence is very different between these three. Lumping them together as equally proven would be misleading, and I don't want to do that to you. Let's start with nattokinase, because it's both the most well-known and, importantly, the most rigorously studied of the three. Nattokinase is derived from natto, a traditional Japanese fermented soybean dish that's been part of the diet there for centuries. Researchers became interested in it partly because regions with higher natto consumption seemed to show lower rates of cardiovascular events, which prompted closer investigation into what was actually happening at the enzyme level. The most compelling piece of evidence we have isn't a small lab study, it's an actual large-scale human clinical trial. This study followed over 1,000 participants, average age in the late 60s, all of whom already had evidence of mild atherosclerosis, meaning existing plaque in their arteries. The study ran for 12 months and was published in a peer-reviewed cardiovascular medicine journal. Participants were split into groups taking either a higher dose or a lower dose of nattokinase daily. The results were genuinely striking for a natural compound. The higher dose group showed a measurable reduction in the thickness of the carotid artery wall, along with an actual reduction in the size of existing plaques. They also saw improvements in triglyceride and cholesterol levels. The lower dose group did not show the same benefits, which tells us that dosage actually matters quite a bit here. This isn't a any amount helps situation. But I want you to notice something important about that study population. These were older adults who already had risk factors, existing plaque, and in some cases high blood pressure or high cholesterol. We don't currently have strong evidence that nattokinase does the same thing in younger, metabolically healthy people who don't already have these risk factors. So if you're in your 30s with clean blood work and no signs of arterial plaque, the honest answer is that we simply don't know whether nattokinase would do anything meaningful for you. That's not me being negative about it. That's just where the research currently stands. Science is allowed to be incomplete, and I'd rather tell you that than pretend otherwise. Moving on to serrapeptase. This one works through a somewhat different mechanism. Rather than being primarily a fibrin-targeting enzyme, serrapeptase is better known and better studied for its general anti-inflammatory properties and its ability to break down dead or damaged tissue throughout the body, not just in blood vessels. It's been used for things like reducing post-surgical inflammation and swelling, and there's reasonable evidence supporting that use specifically. When it comes to arterial plaque specifically, though, the evidence is considerably thinner. Most of what you'll find supporting serrapeptase for plaque reduction traces back to small, older studies, animal research, or anecdotal clinical reports rather than large, well-controlled human trials measuring actual plaque size the way the nattokinase study did. That doesn't mean serrapeptase does nothing. Anti-inflammatory enzymes can genuinely help some people with certain conditions. But if someone tells you with total confidence that serrapeptase dissolves arterial plaque the way that Nattokinase study demonstrated, that confidence isn't really backed by the same caliber of evidence. I'd treat those specific claims with healthy skepticism until we see better human trials. And then there's lumbrokinase, which comes from earthworms and has a longer history of clinical use in parts of Asia, particularly for cardiovascular support. In laboratory settings, lumbrokinase has shown notably strong fibrin-breaking activity. Some comparative lab research suggests it may be considerably more potent gram for gram than either nattokinase or serrapeptase. That's interesting and worth knowing. But here's the catch with lumbrokinase. Despite that promising laboratory profile, we don't currently have the kind of large-scale human trial that nattokinase has, specifically measuring its effect on plaque size in real patients over time. It's the least studied of the three in terms of rigorous human cardiovascular data, even though it has a longer traditional use history. Promising in the lab is not the same thing as proven in people, and I think that distinction matters a lot when we're talking about your actual health decisions. So let's bring this all together honestly. Of the three enzymes, nattokinase currently has the strongest direct human evidence tied specifically to plaque measurements, but that evidence comes from one major study in a specific population of older adults with existing arterial disease, not a large body of consistent research across different groups. Serrapeptase has decent evidence for general inflammation, but weak evidence specifically for plaque. Lumbrokinase has strong laboratory potential, but is missing the large human trials needed to confirm that potential translates to real plaque reduction in people. I think it's also worth addressing something you'll see a lot in this space. Products and claims combining all three enzymes together, marketed as offering a more complete or synergistic effect. The logic behind combining them isn't unreasonable on paper, since they work through somewhat different mechanisms. But I want to be clear that combining ingredients with plausible individual mechanisms is not the same as this specific combination has been tested together in a clinical trial and shown to work better than anyone alone. As far as I'm aware, that specific combined formula research doesn't really exist yet at the level of rigor we'd want. So if you see a product claiming a proven synergistic effect from combining all three, understand that claim is largely theoretical rather than clinically demonstrated. Now let's talk about something that matters more than any of these supplements, and I really don't want this part to get lost just because it's less exciting than talking about enzymes. The biggest, most well-established lever you have over your arterial health is still lifestyle, reducing ultra-processed foods and added sugar, managing your weight and insulin sensitivity, staying physically active on a regular basis, not occasionally, but consistently, not smoking, managing blood pressure, getting adequate sleep, managing chronic stress. These factors directly affect the inflammation and fibrinogen production we talked about earlier, and they have decades of consistent, high-quality research behind them across huge populations. If your lifestyle is actively generating chronic inflammation, no enzyme supplement, however well studied, is going to outwork that underlying problem. Think of these enzymes, at best, as something that might support an already healthy foundation, not a replacement for one. I also want to spend a moment on safety, because this is the part that often gets glossed over in enthusiastic wellness content, and it really shouldn't be. These enzymes affect how your blood clots and how fibrin behaves in your body. If you are currently taking any blood thinning or anticoagulant medication, and there are several types your doctor might have prescribed for various reasons, adding a fibrinolytic enzyme on top of that medication means you potentially have two different things working on your clotting system simultaneously. That's not automatically dangerous, but it's absolutely something that needs to be discussed with the doctor who prescribed your medication, because the combined effect on bleeding risk needs proper medical oversight, not guesswork. The same caution applies if you have any kind of bleeding disorder, if you have upcoming surgery scheduled, or if you're pregnant or breastfeeding. None of what I'm telling you today is a substitute for that conversation with your physician, who can actually look at your blood work, your medication list, and your full medical history, something I obviously cannot do through a video. If, after having that conversation with your doctor, you and your physician decide that trying one of these enzymes makes sense for your specific situation, there's a practical detail worth knowing. These are generally taken on an empty stomach, away from meals, rather than alongside food. The reasoning given is that if you take them with a meal, your digestive enzymes and stomach acid are likely to simply break them down as food, the same way they'd break down any other protein you eat, rather than allowing them to act more broadly in your system. That's the general guidance you'll find associated with how these are typically used, though again, the right approach for you specifically is something to determine with your own doctor, rather than from a video. I want to end this on the bigger picture, because I think it's easy to get lost in enzyme names and forget the actual point. Your body already has a sophisticated system for managing fibrin, clearing damaged tissue, and maintaining healthy blood flow. That system, the fibrinolytic system with plasmin at its center, has been doing this job your entire life. The real question isn't what magic substance can replace that system. The real question is, what am I doing that's overloading that system faster than it can keep up? For most of us, the honest answer involves diet, movement, sleep, and stress. The things we've heard about 1,000 times but rarely actually act on consistently. Address that foundation first. Then, with your doctor's guidance and a clear-eyed understanding of what the evidence actually shows for each of these specific enzymes, you can decide whether additional support makes sense for you. If you found this kind of honest, research-based breakdown useful, that's exactly the kind of content I want to keep making. Going to the actual studies instead of just repeating whatever claim is circulating in the wellness space. Subscribe if you want more of that, and I'll see you in the next video.